My guest, I'm David Ingram, of course, and you're watching Ingram. And my guest is Tom Godwin, and I'm not sure who's doing more talking, Tom or me. I'm trying to get, but I keep on coming up with something that I find interesting. And my problem as a host has always been that I got a good story for just about anything. Dr. Godwin wrote this beautiful book called A Doctor's Notes. It's published by Hancock House. David Hancock, who's been a guest on this program many times. And interestingly enough, from what Tom is talking about, the book is sort of got a lot of stuff in here, the silliness of parts of our medical system and so on, right? Have you read Squandering Billions?
Yes, I have.
You did.
Yeah.
And you agree with me that there's some similarities to it?
No.
No, none at all?
No, my book's quite a bit different. My book is a series.
Well, yours is a bunch of stories, and they're talking about...
And he's more the nuts and bolts of the thing. And I try to illustrate some of the problems by patient histories.
No, yours is much...
more
this is a dry book.
Yeah, this is...
And this is much more personal. I'll agree with you with that.
Yeah,
okay.
Yeah.
But if you want to know what's going on in our health system and things that could be made better, these are two books that everybody should read. If you're thinking about being a doctor, if you're sitting out there in Maple Ridge with a son that you is talking about, or a daughter that's going to medical school, and you're considering sending them to Ireland, or as another lady from North Vancouver was telling me, her daughter's going to medical school in Poland, and that's an interest because the parents are Polish. The daughter gets Polish citizenship and can go to medical school in Poland for about 10% of the cost of going in Canada. And you can go to Ireland, and now we just got to worry about whether or not our medical system here accepts the doctors. We've got, what, 7,000 nurses or something in BC that the Nurses Society hasn't. We got a shortage of nurses, and the Nurses Society is making them go through catastrophic, or whatever you want to call it, stuff to get re-qualified. And we have doctors that have come here that were specialists in Poland and specialists here, and they come over here and they're driving taxis.
I have a short section in my book about the training of doctors and nurses, and that we should actually cherry pick the good things from other countries and even the good things that we used to do in Canada. And it was really true with the nursing situation, because a nurse, or anybody that wanted to be a nurse, if they had the aptitude and reasonable marks at the end of high school, they could go into residence.
Yes.
And then the first year in residence, there was mostly instruction. And the second year, they would get instruction plus some practical experience. And the third year, there was mostly on the wards, and they'd be a nursing supervisee or looking over things. And then at the end of the third year, they got their RN.
And they got paid. They got to do this for nothing.
The last year they made a little bit of money.
They would get some money through this period too.
But the hospital really profited because they had these nurses in training that would do a lot of the work. And it was the same thing for me when I was an intern and then a perpetual resident going through all my training. We were doing a lot of service for the hospital. The hospital was making money on us, especially as medical students, because we drew the bloods, and we counted the number of white cells, and did the hemoglobins and did the urinalysis and some of the simple chemistry tests, the medical students did that.
Knew what was
but
going on.
But now it's all done by lab techs and so on. And we were doing it basically for free.
Yep.
When I was when I was a medical student, I was paid $100 a month, and I got room and board. But I was getting a wealth of experience. And I was doing way more service for the hospital than they were wasting time trying to teach me things. And all the way through my residency, it was like that. We did way more service for the hospital than the hospital had to take.
Did you get a better education out of it, or?
I think so. I think hands-on is the way to go. And people say, well, how could you do that? You got to have your BA or your MA now to get into medical school. Well, I think that's unnecessary. I mean, why should I, at the end of high school, have to take pre-meds and learn another Shakespeare play, read another Charles Dickens book? How is that going to really make me a better doctor, I mean, you should learn computer skills, and you should learn basic chemistry and organic chemistry and then biochemistry. You have to have that. But all these humanities are nice to have, but probably not necessary, and it's expensive. And I think we should...
It's expensive, but it's a time waster as well.
Oh, exactly. Exactly. I was one of the younger
keeps
guys.
Keeps all those people out of being a doctor for an extra 2 or 3 years.
That's right. Exactly that. You know, I think it's tragic that we do it that way. In England, if you have the right aptitude and so on, you can be an MD when you're 21.
Yep.
And same with
here you got to be 25 or 26.
Yeah, I was one of the younger guys in my class, and I just turned 24 when I got my MD. You know, and I was one of the younger people. I mean, that's awful, isn't it? Yeah, because and most of my training was pre-meds. You know, I mean it's not a complete waste of time by any means, but the time could have been utilized much better, and would not have impacted on my knowledge or my way of handling patients or anything, in my view. I think we've wasted a lot of time. And now the nurses have to have a university degree. And that's crazy. Why do they have to have a university degree? We like the old days when a nurse was an apprentice and went through the system that way. And then I was in the transition where we'd see the nurses from university come, and we had the nurses that had trained in the nursing schools right on the hospital grounds. And I would think the majority of the doctors much preferred the nurses that were trained.
Well, because they knew what was going on.
Yeah. And you know, it's the same thing, like, think, well, we can't learn enough. Well, pilots that fly these big airplanes, that's how they learn. They're apprenticed, aren't they? You know, I mean, they take some courses and so on, but they learn hands-on. And that's what I think we should do. It's elitism now, in my view, that's made it so much more expensive.
Well, in my business, which is international tax, I have gone through 2 CPAs and 3 chartered accountants and a CGA in the last 6 years that were unable to do what I'm doing and didn't have the aptitude, whatever, but they had a degree that said under law that they can do it in terms of the things. I'm in the process of training 2 of my children to do it, to take over the business without any of that professional, and they're better than the people that came in with 5-year degrees and so on. So I understand what you're saying. A person who's got some hands-on. Now, what's his name? What was his name? David wrote published Ralph Edwards. Have you read Ralph Edwards' book?
Yes, I did. Yes.
I mean, there's a guy builds his own planes, saved the Trumpeter Swans.
I went to Lonesome Lake. Landed on the lake.
Did you?
Ralph had died by that, but
his daughter was there?
No, Trudy wasn't there, but his son John was.
Yeah.
And John took me on a tour all through his place, and he was in love with his foxes.
Yeah.
Remember when that big fire went through? You know, I haven't been back since the fire was there, but I'll have to go back this summer, see what's cooking over there.
Well, there are stories and there are people that did it. I mean, how old was he? He was still flying forever. And another Hancock House book, Ralph Edwards, Lonesome Lake. And
very good book.
If you get a chance to go to HancockHouse.com, HancockHousePublishers.com. HancockHouse.com. And you'll find a list and backlist of books that are historically fine, and they tell the story of BC, and they tell the story of Native Indians, and they tell the story of exploration, and they tell the story of the railroads, and they tell the story of fishing, and they tell the story of, I mean, just about everything. And then you can find out about renowned cardiologists.
I don't know.
Well, you are.
Not renowned.
Well, look, if I look at all the doctors...
The only difference between me and most doctors is that I took that extra step of writing about it.
And you wrote it down.
So many doctors have seen the things that I've seen, you know, and maybe lots and probably in more detail, but I decided in 1976, as I mentioned earlier, that I had to write this book because all these stories were just going to be lost.
Well, that's the good part about it, and if you write the stories, it's, you know, after a while you'll be able to put all the names in, because I love, the stories are much better if you got all the names in.
I put the names of the doctors, except the odd time, and then with patients, I had to change the situation slightly to, you know, to not interfere with patient confidentiality.
Well, it's nice when you got all that stuff in there. We're going to